Another thing I want to know, what is ordered for comfort measures? I don't want to be in pain, so find out what medications can I get for pain or for nausea or for sleep. Make sure you know what it is and how to get it, because you don't want to be in pain, you want to be comfortable, because this will certainly speed your recovery so you can get home. Now everything has gone well, the procedure went well, your operation as well, and they tell you you're ready to go home. Here's another set of questions that you want to be sure to ask. Now that I've had my procedure or my operation, are there any changes in my expected recovery time? Before the procedure, your doctor said, you'll be good in 2 days. You'll be back to work in 6 weeks. Maybe that has changed. Maybe you're recovering faster and you can go back to work sooner. Or maybe things are going to take a little bit longer. Be sure you double check and you know what is your recovery time and when can you resume your normal activities. So again, ask that same questions. When can I resume my normal duties, my activities, or go back to work? And ask the questions again. What now are my restrictions? Are there any limitations that I might have? An important one to ask is, when can I drive again? If you're on pain medication, they'll most likely tell you you cannot drive until you're off of pain medication. That is for your safety, of course, and others. Climbing stairs. Some operations or procedures, not a problem. You can climb all the stairs you feel like. Others, they're going to tell you, particularly if it's been an operation of your abdomen or your stomach, that you can't do so many climbing of stairs, that you need to take it easy, maybe 2 or 3 at a time, and you might need to arrange, if you have an upstairs bedroom or bathroom, that you need to stay downstairs for a day or 2 until you're fully recovered and you can climb stairs again. Lifting is very, very important to know any limits on your lifting. They might tell you you can't lift anything heavier than a feather, or 5 pounds, or 10 pounds, or they may tell you it'll be quite some time before you can do heavy lifting. Another important question is our sexual activity? This is important for you and your partner to know. Are there any restrictions? Are there any limitations on this? Generally, what we say is, depending upon the surgery, there may be very strict limitations, or there may be, when you feel well enough, please go ahead, because we know that it's important in our lives to feel close to those we love. So be sure you ask this, and don't be embarrassed to ask this. This is a very important part of our lives and our recovery. Now that you've been in the hospital and they've given you all kinds of medications, there might be some changes. So ask again, are there any changes in my routine medications? Have any new medications been added? And if there are, you need to learn about these medications. What is the name? What is the dose? How often do I take them? Are there any side effects? What do I look for? They might give you a new medication and say, we want you to start this when you're home. And you say, oops, I'm allergic to that. Always check again and learn all the information about your medications. I encourage my patients to ask for written instructions and information to take it home. You're going to get so much information. Be sure you get all these in writing, and these can be readily available to you. If you've had an operation, you will have been cut, there will be a bandage on it, a gauze pad, maybe some tape. Ask about that. Ask, how do I care for this at home? Do I need to wash it with anything special? Can I get it wet? Does it have to be dry? Sometimes when we have operations, we go home and there are still what we call drains in place, where fluid drains out over a number of days. Be sure you understand, am I going home with this drain? How do I take care of it? What do I do with it? How do I tell you? Is there anything I need to tell you about this drain? So be sure you get very clear instructions on how to care for the operation or any drains. Ask them, do I need supplies? You might need a prescription to get supplies to take care of this. So get that also in writing before you go home. I always like to take showers, and sometimes I like to take a long bath. Ask, when can I take a shower and/or a bath? They might not want you to be in a bathtub soaking because that might reflect on your operation or your procedure. But a shower would be okay as long as the water just runs over it. So be sure you clarify that, because there is a difference between a bath and a shower and getting something wet. So be sure you know. Another thing that I would like to know, I'm sure it would be on your mind also, ask the question, when will I get the final test results? If a procedure has been done, be sure you know what they found with that procedure. If blood tests have been done, ask what are the results and how does this change my life or what I do. If you've had an operation and a tumor or a mass or something has been removed, you're going to want to know what were the results of that. What was the pathology report? They might not be able to tell you right away because you might need to only stay in the hospital a day or maybe overnight or maybe 2 days, but the final results won't be ready. So be sure you ask when to expect them, and if you're worried, don't sit home and worry. Call your healthcare team member to find out the results. One of the things you'll want to know is, now that you're home, well, when do I go back to the doctor? So make sure you find out the date and time that you go back to your doctor. During your hospitalization, I'm going to guess you're going to see more than one doctor. Find out how many doctors, how many appointments, and how many times. I suggest that you have a little calendar so you can write it down, so when you hear from another doctor, you can say, sorry, I'm busy on that day, I'm seeing another doctor. Are there other members of the healthcare team that you need to visit? Maybe you're going to need some physical therapy, and that's another appointment you're going to have to make. And now that you're home, you're going to need to know, when I'm at home and I have a question or something comes up, who do I call? Who do I call in the daytime? Or who do I call after hours or at night? And as you know, everything happens on a weekend. So be sure you know who to call and when to call if something should happen on a weekend. Now, be sure you know what to call for. I always tell my patients, I want you to call me if you have a fever, if you have pain that's different than the pain we knew when you left, if you have drainage that you didn't have before and is new, or if we send you home with a drain tube and it falls out. I want to know if my patients are eating well when they go home, but now that they're home, for some reason they can't eat, or they're nauseated and their food doesn't stay down. These are some important things that I tell my patients to call me. So be sure you ask your health care team members what they want to be called about. I hope these questions have been helpful for you, and just as a reminder, the questions are available for you at our website. Thank you.